When I first started writing my equity talk, I had this crazy idea about talking of all my personal and professional achievements that I had this year, actually. I wanted to look back at the year and beginning at each month and starting the year in Washington, D.C., all to Rwanda and talk about all the lessons that I learned, what lessons I applied within my team, and what changes I brought all through October. However, for me, something just didn't feel right. I said to myself, Shatyam, how can you only talk about your successes when you're not only defined by those and you're defined by your failures? So today, I am compelled to open up about a defining moment of my life, a profound failure that left a mark on my journey as a health equity leader. I am going to share today a story. It's a story that I never really talk about, and it's the story of a lady called Sharon. Sharon was a sex worker who used drugs, and she was diagnosed with HIV. She was, however, under substitution therapy to treat her drug addiction, and she got pregnant with her first child. The laws, in Mauritius, the laws, which is supposed to be protecting people, they dictated that the state has the duty and an obligation to ensure parental roles if the parent failed to do so, and that role is ensured by the Child Development Unit. So as you guessed it, what happened was that Sharon was deemed to be unfit for her duties as a mother, as she was under the substitution therapy. And when she gave birth, as soon as she gave birth, actually, the Child Development Unit intervened and put her child into foster care. So now the nuance is that when the state intervenes in cases where parents, including mothers who use drugs or who are on substitution therapy, there's a potential for stigma and discrimination or even bias to come into play. There are societal judgments and stereotypes or misconceptions surrounding drug use and those mothers who face greater scrutiny and judgment, which can lead to discrimination, as in the case of Sharon. While we knew that this was going to happen, civil society organizations in Mauritius, we rallied together to fight against this injustice and discrimination, and we partnered with the media, and we raised awareness on the issue, and we questioned the legitimacy of this decision, and asking how can the Child Development Unit judge that Sharon will fail as a mother? So we also asked ourselves, how did the CDU have the ability to decide that Sharon will fail to provide a safe, loving, and nurturing environment for her child when we knew that their judgment was solely based on her drug consumption issues? But anyway, the girl, she was on substitution therapy, and which meant that she was trying to have a better life for her and for her child. So within 1 week of back and forth, where we involved the media, as I said, and civil society advocacy, what happened was that Sharon was able to get her child back. So this was a big win for us in civil society because it changed everything for all those people, all those mothers who were using drugs and for their children. So now let's fast forward to 2021, where there was the second wave of the COVID-19 pandemic. Like most of organizations operating in Mauritius, we were also operating from our homes because we were on lockdown. So what happened that we were just only hoping to go on the field, but I still remember it was during the month of March 2021, where I just got a call, and it was a call where someone said to me that Sharon is in the hospital. And I was surprised, but I didn't really pay much attention to it because it's a normal thing, like someone go to the hospital. I thought it was just the usual that she's in the hospital and I'll check on her later. But it was then one of the outreach workers that I used to work with, she called me and said, her condition is getting worse. And the doctor, on the other hand, was saying that she's doing okay. And the crazy part about it was that no one really understood what was happening since we were in lockdown and we couldn't really move without the work permit that the government issued. And at that time, I did not have that permit, so I was confined to my home. I remember it was a Sunday, when I received some pictures of Sharon in the hospital, where she vomited on herself, and someone sent me that pictures actually, that she vomited on herself, and the nursing staff refused to clean her. And phone calls after phone calls, I inquired about what was happening, and at one point they said she presented COVID-19 symptoms, and right now we're unable to diagnose her, and it might also be TB since she's at the late AIDS stage. So we didn't know what to do at that time. I asked myself the questions, how can a woman who fought so hard to get her baby back be living with a late 8 stage? She had so much to live for. She wanted to live for her child. She was living with aspiration for her and for her child, and she believed that she would be able to break that cycle. She had so much to cherish and a life to live, and she wanted to do everything for her child. All those questions were running in my mind, but anyways, at that point, it was not the concern. The concern was just that let's ensure that she is receiving the care that she should be receiving. So it was already chaotic in the hospital because it was COVID, like you already know, and the staff said, since we are unable to diagnose her, we don't know if it's TB or COVID, we are putting her in isolation. And they attached her hands and her feet, and they put her in isolation, and no one was able to go see her. So I was like, at that point, I was really overwhelmed. I was disgusted. I was even shocked, you know. I was like trying to inquire about what was happening. So I was doing calls after calls after calls, just trying to get someone who would give me an explanation about what was happening, actually. So when I was able to get to someone, she said, you know, the general doctors are not in the capacity of treating her, as in her case, she needs an HIV specialist. And the best part was that HIV specialists don't work on Sundays. So we'll have to wait for tomorrow. And I was like, you know, since her condition is getting worse, we need someone now. We cannot wait for tomorrow. And after countless calls, I was able to get an HIV specialist on the line. And she said to me, you know what, I'm going tomorrow morning, like early morning, and I'll keep you updated. And exactly as she said, in the morning, I received a call where the doctor said that, you know, her condition is okay now, she's stabilized, and we will continue monitoring her symptoms. And I felt clean, I felt like I could finally breathe, you know, like I was doing this for the girl, and like, I'm sure she's in the right hands now. And 5 minutes later, I received a call from her family member who told me she just died. And I mean, the question was, how could she just die when the doctor just told me she's doing okay? I had so many questions in my mind at that time. I mean, ARV treatment is free in Mauritius. Healthcare is free in Mauritius. Like, we have 6 NGOs working in the fight against HIV in Mauritius. How can this still happen? So I had all these questions, and I mean, I wanted to understand where we are failing, what was happening to the healthcare. And the simple answer was that our programs were just failings. We were not placing communities at the center of the heart of our actions. I realized how much we were not close to the community, even if we were saying we were close to the community. We just were not. And for an island, which is like a small dot on a map, we too face inequalities and disparities in the healthcare system, even if it's free. Free doesn't mean accessible. Free does not mean of quality. Free does not mean that communities are engaged within the system. We were just not actively engaging with those marginalized communities, and we were not listening to their needs, and we were not working and collaborating with them to address the challenges that they had and they still have as of today. So similarly, in the case of Sharon, we did not understand Sharon's needs, and none of us knew and understand her personal battles, and none of our programs were addressing the issues that marginalized communities were struggling with. None of our programs aimed to improve the quality of life of people that it was serving. Sharon's story actually has been a haunting reminder of my own failure, a deep and painful wound that refuses to heal. I still remember her face. I still have the pictures on my phone. Like, it's a constant reminder that I knew that our program were not working and I just did not do enough. Or I delayed to try to change something within the system that we were working with, and I delayed in trying to do one thing that I could have done. I knew I could have done it. I knew I had that capacity of doing that thing. I just did not do it. In the depth of my heart, I still carried the weight of letting her down. But it was not only her family, and tragically, her son. I mean, what torments me most in this story is that till today, we don't know what happened to the son. At one point, I was made to understand that her partner took the son, but when we tried to inquire, we don't know if this child is still alive. So we don't know what happened. This is because her partner also uses drugs, and his lifestyle is not is questionable. So we don't really know what happened to the child. Until date, like I said, I still have these pictures of Sharon on my phone, but I never have the courage of looking at them. I don't want to look at them, actually, but because it's a reminder that that woman would have still been alive today. Those pictures are a relentless reminder that putting communities into our program is something that is crucial. It's a crucial aspect that we need to do to address inequalities and achieving health equity. Should we have known the challenges that Sharon was facing, we would have taught her, like help her, and even allow her and help her access those ARV treatments. But we didn't know. So that was our big failure. From that time till now, I understood that building trust within communities is the cornerstone of effective public health intervention. And this is where I promised myself that I will always put communities first. Like community engagement, I know it fosters trust between the affected population, organization, and even authorities that's implementing this program. We cannot just implement program and say that it's going to work. This is never going to happen. We need the voices of those people to be heard, like to influence policies, and we need that now. Now I speak to you all. I'm here today. I feel truly privileged to be here among you leaders, and what I feel happy about is that within this room, everyone understands the involvement of community and the importance behind it. And this significant journey that I had this year has played a crucial part in shaping the person who I've become today, in creating a deep emotional bond with my past, with what happened with Sharon, and it's setting the path for something new, like something new in terms of growth, in terms of resilience, in terms of the work that I will be doing. I understood that many of my actions that I did in the past, I could not have controlled it. This is something that I understood, but now at least I know the things that I can do forward. The program has also equipped me with a profound understanding of social determinants of health, structural inequalities, and the root causes of health disparity, which I would truly say to you, honestly, I didn't know about these things 2 years back during the COVID pandemic. These are all new things to me. And today, I have a broadened knowledge and understanding that has reshaped my personal philosophy, and it has compelled me to view public health as an interconnected system rather than just isolated disease. So in a way, AFHE has helped me make my commitment to health equity to be more solid. I am more than confident that my approach in involving communities in decision, programs, advocacy, that remains the only approach that we need to ensure that each and every person can make decisions about their health, about themselves, and they are participating in those programs so that we are able to advance health equity. Without it, we won't be able to do anything. And this fellowship has only made that commitment to be stronger. And to you, to all my fellows who turn from strangers to lifelong friends, when I hear all of you speak, I no longer have this constant fear that I failed Sharon, actually. I realized that it was just one challenge that was the driving force behind a most remarkable transformation that I have. And this led me to be here today. And a few years back, I would have never dreamt of being here. So this fellowship has instilled in me a sense of global connectedness. I realized that health disparities are not unique to a single region. There are universal challenges that we are all facing. Into my leadership journey, I now recognize the importance of cross-border collaboration, the exchanges of ideas, how we can reallocate resources to address health inequities on a global scale. I now see a new perspective of interconnectedness of our work and the potential for broader impact through international collaboration. And lastly, most importantly, this fellowship also made me realize that maybe not today, I will not be able to look at the pictures of Sharon, but one day I will be able to. I definitely will be able to and apologize to her and say, I'm sorry, but your death was a catalyst to improving the life of many people who's living with HIV in Mauritius. My name is Shatyam, and this was my story. Thank you.